can't see shit on this because it's so bright out. It's like 24 degrees today. So I just started medication for ADHD about 15 minutes ago, so just waiting for it to kick in. I was on waiting list for 3 years with the NHS, and I figured I probably had it since I was about 20 years old. I worked it out. It's a weird appointment today. The doctor definitely seemed to think I had it. My mum came with me. She was describing like behaviour from when I was a kid that I'd completely forgotten about. It sort of lined up with it. She told the doctor a story about me wearing welly boots for about a year to bed. Like I would scream and cry when I was a little boy unless I wore my welly boots to sleep. And that's because the doctor asked her about textures. Does he have any weird things that he used to do and stuff like that? I thought that was just kid behaviour, I guess. And it is child behaviour, but it's not typical for some, I guess. A bunch of other things. That was just a funny thing that I'd completely forgotten about. Man. So I'm making this just so that I can check back in, I guess, later, and I'll let you know how it feels at that point. I was started on 10 milligrams methylphenidate chloride, I think, 2 times a day, one at 8 a.m. and one at 3 p.m. I picked them up at the hospital with my mum about an hour ago. It's close to 3 p.m. now, so I took the first dose. Maybe I'll make the hip hop name origin video now. I think if anything, these will help with editing, paying attention to like fine details and stuff like that. So yeah, I'll check back in. And for clarification's sake, once I got back from the doctor's, I smoked 2 joints in about 20 minutes. So there's that in my system at the moment as well, which is typical. It's kind of normal, but I didn't want to smoke up before I went to the doctor's. Oh, and the doctor asked me, do I do any drugs? And I'm like, yeah, I smoke weed daily. And he's like, right, try and cut down. So I'm going to honestly try and do that, because they'll obviously counteract each other. I was using cannabis for focus, really. So we'll see how things go on, and I can maybe talk about how that plays out, the 2 different drugs. Alright, see you soon.